Hello, everyone. Let's discuss a few common mistakes that are made by students while answering a 10-mark evaluative question in paper 3. Now, if we speak about an evaluative question, this question over here reads, evaluate the psychological explanation, that is cognitive, behavioral, and psychodynamic, of obsessive compulsive disorder. Now, this is the part of the syllabus that the examiner wants us to evaluate, including a discussion on individual and situational explanations. Now, when the examiner says including a discussion on individual and situational explanations, this is referred to as a named issue. Named issue, as in this is the topic that the examiner wants us to bring in under discussion. Now, starting off with the common mistakes here. Number one, candidates cover the named issue in detail, but no other issue. Now, taking you back to the question, remember this says include a discussion of individual and situational explanations. That, in other words, means along with discussing individual and situational explanations, there are other issues that you are expected to bring in too. Ideally, 3 issues. Now, this is what I'm talking about. You evaluate in terms of the named issue, and then you evaluate in terms of a second issue, and then you evaluate in terms of a third issue as well. So let's just say this is a named issue, a second issue, and then the third issue. So what the common mistake over here that the examiner feels is many candidates, they cover the named issue in detail, but no other issue. Avoid doing that. One. Number two, candidates do not cover the named issue at all. Remember, the question read, including a discussion. So the question is, or the examiner is very clearly specifying that this is something that has to be a part of your answer, right? So the first common mistake, many students, they end up explaining or they end up evaluating through the named issue in detail, and then that's it. Then they wouldn't bring in other points under discussion. The first point, the first common mistake. The second common mistake, many students, what they do is they do not cover the named issue at all, which again would lose you a lot of marks. Number three, when candidates give too few examples to explain evaluative points. When you're explaining a particular evaluative point, remember, use examples. When you're using examples, your examples help show the examiner, helps the examiner to understand that you know what you're talking about, right? Number three. Number four, candidates do not give definitions of the issue. Now, let's just say the named issue over here was individual versus situational explanation. So when you're starting a paragraph, you might as well define what individual and situational explanation is, so that you are making it clear to the examiner, so that you're making it clear to the checker that, oh, see, this is the issue that I'm trying to bring in under discussion, and I exactly know what this means, right? Number five, rather, there's no analysis or very limited analysis that represent. You get marks on analysis, right? This is a question, this evaluative question, that is worth 10 marks. And through this question, the examiner tries to test you through AO3. AO3 is assessment objective 3. AO3 means evaluations and analysis, right? So if you're not analyzing, if your answer does not have analysis present in it, how do you expect to get marks? How do you expect to get marks from the top band, right? Now, taking this ahead, there is no analysis or very limited analysis. Example using the phrases similarly and in contrast, without explaining why the explanation, treatment, theories, etc. are similar or in contrast. Now, as we speak about analysis over here, many students, they'd try playing smart. They'd very conveniently try using these terms or these phrases such as similarly and contrast, right? Anyone could do that, but you need to show the examiner why you think there is a similarity, or what do you think is a similarity. You need to explain that, right? Your answer needs to be detailed. If it's not detailed, then you're not getting marks from the top band. Now, so this fifth point over here, there's no analysis or very limited analysis. If there's no analysis or very limited analysis, again, you're losing your marks here, right? Now, the examiner is trying to explain this to you when the examiner says using the phrases similarly and in contrast without explaining why without explaining that particular point would be considered a limited analysis, right? Taking this, to avoid doing that. The next point, an extreme view is presented. Now, many students, they make it sound so absolute. I've been saying this for years, for almost 2 decades now, I keep on telling students, we are studying psychology, or when we're studying sociology, this is not math, and there's no 2 plus 2 is equals to 4 over here. We need to understand we are dealing with humans, especially when you talk about clinical psychology over here, we're dealing with humans, right? When you're dealing with humans, how could you be so sure or so certain or sound too deterministic? There's always a flip side of the coin. Now, for instance, an extreme view is presented. Example, an explanation is considered to be fully deterministic rather than a balanced pro explanation. So, like I keep on saying, try keeping it balanced rather than providing a balanced explanation of how an explanation, rather than a balanced explanation of how an explanation could be considered to support both sides of an issue or a debate. Now, I hope this helps. I would like to read you this answer where the examiner has given the student 5 marks out of 10, and this sort of an answer, we consider it as a middle range answer. Now, again, the same question: evaluate the psychological explanation, cognitive behavioral and psychodynamic of obsessive compulsive disorder, including a discussion of individual and situational explanations. Now, why is it that I'm doing what I'm doing? I'm trying to read this to you, trying to help you understand the mistakes that students make so that you could not repeat them, right? It's good. It is always good to learn from the mistakes that are made by other people and not try to make mistakes ourselves. Now, to begin with, the individual and situational explanation can be applied to the behavioral explanations, as the person with OCD has learned to do their compulsive behavior due to their environment or situation. So, what are we talking about here? The individual and situational explanation, this is our named issue, can be applied to what can be applied to the behavioral explanation, as the person with OCD has learned to do their compulsive behavior due to their environment or situation. The unclean, now this is where the explanation over here or the development of the point begins. The unclean environment is prompting their obsessive behavior. In contrast, now, see, so this explanation starts over here and ends right away. Moving on, we have another explanation of OCD that the student has bought in. In contrast, the psychodynamic explanation is individual, as the conflict that exists between the superego and the id will be unique to everyone, right? Now, we are referring to the psychodynamic explanation being based on the individual explanation, right? The psychodynamic explanation is individual, as the conflict that exists between the superego and the id will be unique to everyone. Understandable. The type of compulsive behavior that the ego uses will also be different. Example, some people will clean, others will check their obsessions, check things obsessively. Now, this is the paragraph. Let's have a look at what the examiner feels about this particular paragraph, right? If you haven't read this properly as yet, you might as well pause it here and read through this. If you're done reading this, moving on towards how the examiner feels about this particular paragraph. The first evaluative point. The first evaluative point is the named issue, and there is some detailed explanation. See, some detailed explanation as to why behavioral and psychodynamic explanations are either situational or individual. The selection of evidence is appropriate and is effective. Makes sense. There's also some limited analysis, as the candidate correctly identifies that the two explanations are in contrast to each other in terms of this issue. Let me take you back. Look at this word. I'll just highlight it with another color, green. See this, when the student writes in contrast, right? This is the analysis we're talking about. Now, why is it that the examiner feels this is a limited analysis? Let's try figuring that out. Yeah, the selection of evidence is appropriate and is effective. There's also some limited analysis, as the candidate correctly identifies that the definition of the issue at the beginning, as the candidate correctly identifies that the two explanations are in contrast to each other in terms of this issue. To improve, the candidate could give a definition of the issue at the beginning of the answer to show understanding of the issue, right? Now, this is something that I believe I mentioned a couple of minutes back as well. So, in addition, the candidate could provide a comparison with one or both of the explanations. Remember the psychological explanation of OCD. Even if you have a look at our syllabus, it is divided into three parts. I mean, even if we have a look at the question, it shows us that it is divided into three parts: number one, number two, and number three. This psychological explanation is could be cognitive, could be behavioral, or could be psychodynamic, right? So what does the examiner mean over here? To improve, the candidate could give a definition of the issue at the beginning of the answer to show understanding of the issue. In addition, the candidate could provide a comparison with one or both of the explanations that the explanation can be considered to be both situational and individual, with some examples to explain why this is the case. Now, how do we do this for in order to understand what exactly is the examiner referring to? You might as well, I put up a video yesterday, you might as well, I'm forgetting the title. So yeah, how do you score a 10 on 10? You might as well go watch that, and through that you'd figure out how or what exactly the examiner means when they say that, along with discussing in terms of contrast, you could also talk about this part, right? Now, taking this ahead, or the candidate could explain a strength and a weakness of having a situational or individual explanation and apply this to the behavioral and psychodynamic explanation. So generic strengths and weaknesses of having individual or situational explanations could be bought in. However, you'd be expected to link it to either the behavioral and the psychological explanations, either one of them or both of them, ideally. Now, moving on to the next paragraph here. The second issue is the nature versus nurture. The second issue over here is the nature versus nurture debate. Nature is what we born with, and nurture is what we learn through experience. So the named issue has been used. Now moving on to another issue here, right? So the second issue is the nature versus nurture debate. Nature is what we're born with, and nurture is what we learn through experience. The behavioral explanation is on the nurture side of the debate, as OCD is learned through negative reinforcement. The person learns that cleaning, for example, lowers anxiety, so they continue to do this behavior until it becomes obsessional. In contrast, the psychodynamic explanation is due to nature. Everyone is born with an id, ego, and a superego. Now, do you see, if we talk about a comparison between the first point and the second point, the first, if we talk about the first difference between them, the second issue, that is the second debate that has been brought in over here, that is the nature versus nurture debate, has been defined at the beginning, right? We did not see this in the first paragraph. Having a look at what the examiner feels about this, let me just put it into box so that you guys don't get confused. Okay, so the second evaluation point, nature versus nurture, starts well with the definition of the issue and a clear example of why the behavioral explanation supports the nurture side of the debate. This is an indication of analysis through a comparison with psychodynamic. But the example given is not correct, as this explanation is that we're born with an id, and our ego and superego develop later in childhood, right? Now, id, ego, superego. The psychodynamic explanation, Freud, right? I hope you all remember this. To improve this, candidate needs to give an example of how the psychodynamic explanation supports the nature side of the debate. Example: everyone has an id, ego, and superego, and these will develop during childhood, and everyone experiences the psychosexual stages of development, as Freud claimed. In addition, the psychodynamic explanation also supports the nurture side of the debate. Example: through childhood experiences which affect the id, ego, and the superego. So we have the second issue as the nature versus nurture debate. This is what is written by the student. This is what the examiner feels. I mean, you can pause at whatever point you feel you need to read through it thoroughly again. Moving on, the third issue. A third issue is the ideographic versus nomothetic debate. This one. The psychodynamic explanation offers both an ideographic and nomothetic approach to the development of OCD. The explanation has a general law that everyone with OCD will have it because of the unresolved conflict between the id and the superego. However, it also suggests that everyone will have their own individual experience of the conflict, and so there are different types of OCD. In contrast, the cognitive explanation is nomothetic, as it gives a general law that it is the obsessive thoughts that are cause of OCD. Now, if you know the content, I'm deliberately not delving into the content over here. That's what it would make this video super long. And at this point, I feel your time uh is super precious. Now, uh having a look at how the examiner has commented on this. Here you go. The third evaluation point, that is ideographic versus nomothetic, does give a good explanation of why the psychodynamic explanation supports both approaches, and a clear comparison is made. There's a very brief evaluation of the cognitive explanation for OCD, which could be extended with an example. In addition, this candidate could explain how the cognitive explanation is also ideographic in a similar way to the psychodynamic explanation, right? This is what the examiner feels about the third paragraph. Moving on to the fourth and the fifth paragraph. Okay, now this fourth and fifth paragraph, I think I did mention this a minute back, I mean a few minutes back, but you're expected to give three evaluative points, including the named issue. You don't really need to bring in this fourth and the fifth issue. So the fourth issue is reductionism. The behavioral explanation is reductionist, as it ignores the cognitive and psychodynamic explanation. Similarly, the cognitive explanation ignores biological causes as well as the psychodynamic explanation. The fourth issue. The fifth issue is determinism. The cognitive explanation is deterministic, as the person has no control over their obsessive thoughts. Let's quickly have a look at what the examiner feels about this. The fourth and the fifth issue, evaluative issues, are very brief and do not give any examples to explain why the candidates thinks the explanations are reductionist or deterministic. To improve this, candidate is also under the impression that explanations are either reductionist or not, or deterministic or not, and could use examples to present a more balanced view. So yes, a balanced view is ideally required. It would be better for this candidate to focus on the first three evaluation issues and give more examples to back up the points rather than attempting to cover five. Now, I'd want to reiterate, the examiner wants you to focus on three issues, not more. Remember, it is a 10-mark question for which you should not spend anything more than 15 minutes, right? Because if you do that while attempting to answer on clinical psychology, there's a possibility that the last answer, which again would be an evaluative answer, you might miss on that, right? And it would not be worth it. So keep a check on time too. So these are a couple of common mistakes that students make. I'd just I'd put these paragraphs along with the comments on a single page and show them to you, so that it gets easier for you to understand. Here you go. This is the first paragraph, and this is what the examiner has commented about the first paragraph. This is the second paragraph. This is what the examiner has commented on the second paragraph. You might as well pause this here and read through it so that you exactly can tell. Now, this is the third paragraph, and this is what the examiner has commented on the third paragraph. This is the fourth paragraph and the fifth paragraph, and this is what the examiner has commented on this. So I hope this was helpful, and I hope you would be able to keep these mistakes that typically students make in mind, and avoid making these mistakes yourselves. Good luck for your paper. Thank you.